Anorexia in simple terms is a loss of appetite characterized by the DSM-5 by low weight, intense fear of gaining weight, and a distorted perception in which one's body is seen. There are two types of anorexia, the restricting type and the binging purging type. The restricting type is when people reduce the amount of food they eat in order to lose weight, or by fasting, and even by excessive exercise. The other type, the binge eating purging type, is when individuals eat large amounts of food in a short period of time and then purge through vomiting, taking laxatives, diuretics, or even enemas. Anorexia is classified by severity. A body mass index (BMI) between 18.5 and 24.9 is considered healthy. Someone with anorexia with a BMI between 17 and 18.5 is in the mild severity. A BMI of 16 to 17 is considered moderate, a BMI of 15 to 16 is considered severe, and having a BMI of less than 15 is considered extreme. Anorexia leads to the breaking down of body muscles and fat. The loss of muscle tissue throughout the body causes muscle weakness and fatigue. Even the heart loses cardiac muscle, leading to bradycardia, hypotension, orthostatic hypotension, and eventually leading to congestive heart failure. An anorexic patient has low protein levels in their body, causing significant edema. Anorexia nervosa leads to serious electrolyte abnormalities like low potassium, magnesium, and phosphate levels. There is also vitamin and mineral deficiencies such as vitamin D and zinc deficiencies. Anorexia causes amenorrhea in females, and it also affects the sperm production and erectile function in males. Also, anorexia can cause osteoporosis due to the depletion of calcium stores in the body. The skin is also affected, becoming dry and flaky, and also hair can become brittle and fall out easily because of lack of nutrients. Finally, anorexia affects the brain, causing ataxia, confusion, and even encephalopathy. When it comes to treating anorexia, the treatment goals are mainly three. Number 1, restoring normal body weight. Number 2, establishing healthy eating habits or patterns. And number 3, helping patients see through their distorted body image. Standard treatment of anorexia nervosa is nutritional rehabilitation and psychotherapy. Cognitive behavioral therapy helps patients to recognize their distortions in thinking and then to re-evaluate them. When it comes to nutritional rehabilitation, the route of treatment depends on the severity. Mild to moderate cases with no medical complications get outpatient treatment, where the goal is to gain 0.5 to 1 pound per week. Nutritional rehabilitation is given through oral intake of food. In case of severe to extreme cases, the patient requires inpatient treatment, where the goal is to gain 2 to 3 pounds per week. If the patient is able, oral intake of food is indicated, but sometimes we might resort to total parenteral nutrition. Individuals with severe to extreme anorexia nervosa need to be hospitalized for inpatient treatment, especially patients with these indications: having unstable signs like heart rate below 40 beats per minute, blood pressure below 80 over 60 millimeters mercury, weight less than 70% of the ideal body weight, or BMI less than 14 to 15 kilograms per meter square. Dehydration, or when there is medical complications like syncope, seizure, cardiac dysarrhythmias or cardiac failure, liver failure, hypoglycemia, or hypophosphatemia. Pharmacotherapy is used as an adjunctive treatment in specific cases. Acutely ill individuals who did not gain weight despite treatment with nutritional rehabilitation and psychotherapy can use a low dose of the antipsychotic olanzapine, 2.5 to 10 milligrams per day. To reduce anxiety before feeding, we can use benzodiazepines, lorazepam 0.5 to 1 milligram, or oxazepam 15 to 30 milligram. Bupropion is contraindicated because it's associated with higher incidences of seizures in individuals with eating disorders.